Hey folks, and welcome to Natural Defensive Tactics, Episode 4. I'm Joe Calderon, and thank you for joining me today. I did get a request on people wanting to share this link. Please do if you want. You know, it wasn't really the purpose, but if it could help other people, fantastic. It's week 4 of the quarantine, and hopefully everybody's out there, they're safe and staying busy. I'm trying to stay as busy as possible, so this is one of the avenues I'm using. So thank you for that. Today we're going to talk about motor skills. We're going to talk about a breakdown of a confrontation, some cues to give you, and give you a couple of self-defense tips. The first thing I'm going to talk about though is the self-defense tips. And if you've flown with me before or worked with me before in the past and in other areas, you know I carry a pen usually when I enter and exit an area, maybe a big pen, but usually a pen. And I've always believed it's better to have a piece of equipment and not need it than to need it and not have that piece of equipment. So soft tissue areas, a puncture weapon, it's a contact weapon. If you don't have a pen or a big pen, I'm sure in your hotel room or in the back of an airplane or anywhere, a dentist's office, you'll have a magazine. And simply just rolling the magazine up as tight as possible becomes a nice contact weapon. And all it is a magazine. I remember way back when a captain I flew with, I walked out of the hotel in Narita, and I had a magazine in my hand. And from that point on, once I talked to him about why, every time I saw that captain, he had a rolled up magazine in his hand. The last thing is in the mornings, afternoons, or night, if you're going out alone, it sure would be nice to have something on you that you can use. There's flashlights, there's all kinds of other things that you can use that are non-threatening. A simple cup of coffee works. You walk outside your hotel room and you go to the elevator and you see a confrontation that's developing. You can't get out of the way. It sure would be nice to have a hot cup of tea or water, be able to deploy that and get out of the situation. Again, non-threatening. A pen, a magazine, or a cup of joe. Anyhow, moving on. Gross motor skills, complex motor skills, and fine motor skills. I know for a fact I cannot thread a needle. I can't do it typically. It takes me forever. And at a resting heart rate of 60 to 80 beats per minute and having difficulty doing that, I know if my heart rate goes up, that I'm out. Completely out. I don't care what martial arts system you come from, or if you're born on the top of Nepal and you've been taught by Buddhists. When your heart rate goes up, you won't be able to be that calm. You just can't. So why build techniques that take fine motor skills to deploy? Just doesn't make sense. In the same light, complex motor skills, which occur from a resting position of 60 beats per minute to probably about 140 to 145 beats per minute before they begin to deteriorate. Why build a system where you have to do a whole bunch of maneuvers or techniques to do the same thing that maybe a gross motor skill can do? And most of your best fighters in the world, whether they're Muay Thai, MMA, boxers, it doesn't matter. Your best fighters, when they train, they're training between 115 to 135 to 140 beats per minute. And that allows them to reach back and pull some of those complex motor skills when they need to. Most of us will not be able to do that. We'll go straight from 60 beats per minute to 175 to 200. At about 175 beats per minute, most of your complex motor skills are gone. And all you have left is the big push and pull, grab and swing motions, big muscle groups left. So why not rely and teach gross motor skills in defensive tactics or self-defense? Makes sense to me. Over 200 beats per minute, you're in hypervigilance. and what we like to call the fight or flight and freeze. And you can't pick which one it is. You're just going to do it. You're kind of deer in the headlights, that brain fart, and you can't explain what's going on, right? So what we're trying to do is build a system where you're probably not going to rely on any complex or fine motor skills, just gross motor skills, and try to keep your heart rate down using tactical breathing and a few other techniques so you don't get to that 200 beats per minute and lose everything. So that's, in a general sense, that's kind of an ad for gross motor skills. And we'll, on later episodes, we'll talk about those techniques, just gross motor skill techniques. Moving on to a confrontation. If I was to ask the viewers out here, when was the last time you got in a fight? Boy, I would probably say very, very few of you would raise your hand. And if I was to ask you when was the last time you got in a fight as an adult, less. I mean, it'd be onesie-twosies. There was a guy after 9/11 when I was teaching a safety security course for the airlines. I taught over 1,200 pilots self-defense in Los Angeles. And I would ask that same question, and out of the 1,200 pilots, one pilot raised his hand, and he knows who he is, of the 1,200. So we're good people. If there's a fence, we don't jump over the fence. We're good people. We're law-abiding people. And so it's difficult to change your mindset a little bit and start talking about a confrontation because we're not used to it, And so that's what I'm going to talk about today, giving you some cues on when someone's about to launch on you, what their face does, what their body does, what their hands do. And the way I break this down is the first thing is you got to transfer your intent to action, right? And I break it down into 3 areas. The transfer could be words initially, just the dialogue, getting in your face and huffing and puffing and using all kinds of profanity. That's probably about 10% that's going to go to the action. Most guys don't say, blank, 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 and then punch you. Then it's the voice. So I can say blank, blank, blank on a soft tone voice, and it probably doesn't have the same meaning than maybe yelling at you. The tone changes, the inflection, and even the pitch. So the combination of cussing, profanity, and changing the tone and the pitch changes things, and that's probably another 20 or 30% of that. The rest of it, that 70%, is a huge leap from the transfer of intent to action, and that typically is body language. And typically what happens is when someone's about to launch on you, and I'll just start from the head down, their chin's usually not going to come up. They may start like this, trying to act like they're tough guys, but they usually pivot down, and for 2 good reasons, and both reasons I adhere to is when you pivot down, your animal instinct starts kicking in. You're going to be target fixated with your pupils. Your eyes are going to dilate a little bit to bring in more light to see better, basically. And if you take a shot, it's for protective measures too. If you take a shot to the head, if your head's down like this, the punch is usually going to glance off your forehead and streamline down. The other thing is your neck, your carotid arteries are not exposed. So that's just a natural response for somebody that's about to launch on you, is to pivot their heads down, their chin down just a little bit for a protective measure. I talked about the eyes dilating. Now, if you're looking at his eyes too long, you're probably going to get hit. So we just know that the eyes start dilating so they can take in a little bit more light and be more acute. The nose starts to flare. Now, I've got a huge nose, so it's not fair, but typically the nose starts to flare, almost like an animal instinct. The breathing becomes a little bit more shallower. And sometimes if they're still talking, whatever they're saying is starting to not make any sense. because they're target fixating on the next action now. Sometimes to deploy kind of a deceptive strike or an ambush strike, and they're in this position. They start looking around. They're probably, some people say they're looking at witnesses, make sure who's around. Not normally. Normally, a guy that's going to, or woman or a guy that's going to deploy an ambush attack on you, as talking to you, confronting you, is looking around so you're distracted, so he can all of a sudden haul off and hit you. So that's another imminent strike that's about to happen. They're all looking for the knockout blow. Okay, nobody's going to get in a position like this and jab you. I've never seen anybody get knocked out by a jab. Period. I've 40 years in this business. Never. So they can set up their body. They're gonna blade. We call blading on you a little bit. I'm right-handed or dominant right side. So if I'm square with you, talking to you, and I blade away, and I take my dominant foot to the rear just slightly, and you can see my shoulders pivot, I'm about to strike you. Okay? Not many people strike from here except they push, maybe. But when they're going to hit you, they're going to pivot away and put that dominant side to the rear. We're also going to talk just a little bit about a kind of a trembling sensation. So what you'll see is they're nervous too. Trust me. So as their breath gets a little bit shallower, their fingers and their fists are going to shake. And if you could see their legs and their knees, that's also shaking typically. And if you've ever been mad, I mean really mad, you know that your fingers and your legs somewhere shake. They do the same thing. Let's see here. So if someone's about to launch on you, typically, like I said, if their face kind of pivots down, kind of a stare at you, and they go from a square position, and they start to blade off on you a little bit, just a bit, and you see them either clench their fists or start shaking, they're about to deploy some nastiness on you, okay? And that's episode 5. So don't get in the fight now until we start talking about episode 5 and beyond, so you can counter and be safe. Anyways, hopefully this lesson about gross motor skills and the confrontations on some cues on what you might see out there was helpful. Please be safe out there, and I'll be back in a few days or in about a week. So thank you again. I'm Joe Calderon for Natural Defensive Tactics.